Honourable member for, what do we have here? Vancouver East.
Thank you very much, Mr. Speaker, and congratulations to you being appointed in the chair. I'm very happy to rise in the House today and to follow the member from Churchill and to hear what she had to say about the budget. And although we represent very different parts of Canada, she's from the north, I'm from an urban centre in the south on the west coast, it's really quite incredible to know that what she heard during the election on the doorsteps is very similar to what I heard from my constituents in Vancouver East. And first of all, I'd like to certainly thank the good folks in East Vancouver for re-electing me for the 6th time. It's a pretty amazing community of very diverse neighbourhoods. It's a place where immigrants come, where people make their place and their way in Canada. It's a place that has a lot of labour history and social activism, but it's also a place that's really struggling, where people are struggling with the incredibly high housing costs in Vancouver, and I'm going to talk a little bit about that. So it's a good place to live, but people are really hurting and they're having a very hard time. Mr. Speaker, I want to say at the offset that I feel so incredibly proud to be part of this amazing caucus of New Democrats where so many young people have been elected. It feels like a breath of fresh air that's come in, and I kind of hope that it turns politics upside down in this place as we get these new perspectives and experience from young people. And, you know, in the election campaign, you hear so many people saying, well, you know, we've got to get young people involved. Why don't young people vote? Why aren't they engaged? Well, here we saw it in some incredible candidates. And I know in my riding in East Vancouver, the engagement of the youth vote was really something that we've never seen so strongly before. We had vote mobs. We had people who were raising the visibility and the awareness of the campaign and the issues. And so, you know, things like the use of social media, whether it was Facebook or Twitter, was quite wonderful to see, and it provided a new way of interacting with voters and constituents. So I feel very, very proud to be part of a caucus that, first of all, has a historical number of women in our caucus, and also so many young people who are going to give us strength and a sense of hope about what politics is in the future. Mr. Speaker, in commenting on the budget that we heard yesterday, two things that I want to focus on because they're very important to folks in my community. One is healthcare and one is housing. You know, I got an email from a young family just a couple of days ago, and they've lived in Vancouver for about 14 years. They have a combined income of $80,000. They're working hard. And they talk about saving to buy a house, and they say it's like running towards a finish line that is moving away from us faster than we can run. And then they point out that they're currently paying $1,450 a month for a small one-bedroom apartment in a house of 3 suites in East Vancouver. Now, East Vancouver used to be relatively affordable. Now it's, you know, Vancouver overall is a very, very expensive city to live. So one of the things that I was looking for in the budget was whether or not there was any commitment by the government to an affordable housing program. And I was incredibly disappointed to see that there wasn't even a mention of housing in the budget. And, you know, it's not just my community. Right across this country, whether it's in the north where people are living in appalling third world conditions, whether it's in urban centres, whether it's homelessness. And I know in Vancouver, we just had the recent homeless count in Metro Vancouver, where we know that close to 2,000 people are living in shelters. Some of them are, and part of the count was people who are staying overnight in jail or a detox or an addiction facility. I mean, that was part of the count. So we know that the number of people living in shelters is still going up. So it's a crisis across the country. So the fact that this Conservative government has turned a complete blind eye to the housing crisis that's developed in this country, to me is quite astounding. And I think maybe they believe it's something that government shouldn't worry about. But the reality is in Metro Vancouver, which is the Lower Mainland, there is now a rental housing supply coalition. And it may surprise some of the members opposite to know that a part of that coalition is the Real Estate Board of Greater Vancouver, the Canadian Home Builders Association of BC, the Cooperative Housing Federation of BC, the BC Nonprofit Housing Association, the Tenants Resource and Advisory Committee. This is a a number of coalition partners who don't usually work together, but they are now, because the crisis in our city is so severe. The City of Vancouver is doing as much as it can, but there's been an absolute absence from the federal government. Now, I heard the Minister for HRSD say today or yesterday in question period, well, we put all this money in the Economic Action Plan, et cetera, et cetera. Well, the fact is that was a one-time infusion. What we need in this country is a long-term national housing strategy, and I fought tooth and nail for that for many years, and I know all of us in the NDP are going to continue to do that, because we can't just continue with a society where some people get more and more wealthy and other people, even middle-class people now, coming back to this young couple who make $80,000 a year, once that was a good enough amount of money to buy a house, a modest house. No longer. So not only do we have people at the very bottom who are more and more vulnerable, but we also have students, we have seniors, we have young families who are finding this housing affordability crisis something that is now eating into their food money, their education money, and it gets harder and harder to make ends meet. So, Mr. Speaker, that's one thing that I know for us as New Democrats, we're going to fight tooth and nail for. The second thing that I just want to mention quickly is about healthcare, because this is obviously a huge issue that's looming before us. And I heard the Minister of Health today, because we raised it in question period. She talked about the health accord that's coming up for renegotiation in 2014, and she basically said, don't worry, it's 3 years away. Well, I want to tell her and the Conservative government, we are really, really worried about what's going to happen with this health accord, because the accord that we had in 2004 that came about with Paul Martin's government, it was basically an accord that had no strings attached. But it did make some commitments for a national pharmaceutical program, for long-term care, for home care. It made some commitments that there'd be progress on these things, like a renewed sense of Medicare, phase 2 of Medicare. Well, as we just saw this week, the Health Council of Canada, that is the monitoring group for the accord, came out and basically said stalled, that the national pharmaceutical program has been stalled. Why? Because the federal government has been absent. So I want to say, Mr. Speaker, that this is an issue that crosses every political stripe. It crosses every part of society in terms of people's concern about what's going to happen to our public healthcare system. And I want to say this, it's often portrayed, and there are myths that put forward, that somehow Medicare or our public healthcare system is not sustainable. This is actually not true. It's something that, like, the Conservatives would like to make us believe, because, of course, there's been a great lobby from these powerful pharmaceutical companies and lobbyists to privatize our system. But Medicare is actually very sustainable. It's actually the private health costs, like the costs of drugs, that are driving the costs up of healthcare. So we see a situation where 25% of Canadians do not have any drug coverage. I mean, this is astounding when people are digging deeper and deeper into their pocket to pay for basic prescription costs. So, Mr. Speaker, I want to put the other side of the House on notice that on this issue, on healthcare, they will see an enormous amount of vigor and vigilance from the NDP to hold the government to account and to make sure that the health code that is renegotiated covers these basic quality of life issues around Medicare, so that we can uphold the 5 principles of the Canada Health Act. Thank you very much, Mr. Speaker.
Questions and comments? Your honourable member for Nickel Belt.
Thank you, Mr. Speaker, and I'd like to congratulate the member from Vancouver East for being re-elected, I believe she said, for a 6th time. That shows the confidence that the people from Vancouver East have in their member, and I can assure them that they are well represented. I'd like to ask the honourable member a question on a national housing strategy. I'd like her to explain to the House what a national housing strategy would do for the poor of Canada.
Member for Vancouver East.
Mr. Speaker, and I'd certainly like to thank my good colleague for his re-election, and I know that he has worked very hard for his constituents, and he is one of the members that has supports very much the idea of a national housing strategy. It's very simple. It's the idea that the federal government has a critical role to play in this most basic of human rights, and that is the provision to safe, affordable, and appropriate and accessible housing. And in fact, we used to have really good housing programs in this country. The federal government always played a role, but in the name of cutting the deficit in the 90s, that was all gone. And we should learn from that. It was a former Liberal government, but the consequence of that public policy decision has been disastrous in terms of increasing homelessness. So we're absolutely committed to the need for the federal government to be a player, to participate with the provinces, the territories and municipalities to make sure that there is a national housing strategy so that no Canadian, wherever they live, is homeless or doesn't have safe, secure and affordable housing.
Questions et commentaires? The honourable member for Okanagan-Coquihalla.
Thank you, Mr. Speaker, and it's a great honor to be here and to represent the Okanagan-Coquihalla. I just want to applaud my colleague's election win and thank her for her bringing her concerns up in the House today. Just a simple question on health care. Health care is clearly something that we're all concerned about. Canadians did say at the doorsteps, although my colleague, I have to say, is it seems that we all must have a selective hearing, because what I heard at the door is much different than what many of the other members on both sides of the House, or on this side of the House, have said. But when it comes to health care, we have said that we will carry through with our commitments. We said we are going to continue to fund that 6%. How do you propose that, and since it is a provincial responsibility, how do you propose we carry forward, knowing that that is a provincial responsibility? It's not something to be bullied or to be pushed. That's something that the provinces have to work with in conjunction with the federal government. I would just like to hear how you plan on doing that, and also how do you plan on paying for it? Because we all know we have the best of intentions, but there are real issues here as far as where the money goes, where it comes from.
Member for Vancouver East.
Well, I thank the honourable member for the question, and I've not actually heard anyone, far be it from us, to suggest that there's going to be any bullying that takes place. It is a negotiated agreement, and I would agree there has been a commitment actually by all parties that there should be a 6% increase even 2 years after the accord continues. But, you know, it's not only just about the money. It's about where that money goes and what it's used for. And one of the real challenges that we face is that we now have sort of a patchwork across the country. Some provinces have some drug coverage programs. Some provinces have some long-term care or home care. It's a real patchwork. And we believe that phase 2 of Medicare that was started by Tommy Douglas in Saskatchewan, that is really an icon of a Canadian value, that phase 2 of Medicare must encompass at least a national drug coverage plan. And that's what we've got to negotiate. And believe me, the provinces would love to do that. What's been absent has been the federal government.
Questions and comments? Honourable member for Winnipeg South. I'm sorry, Winnipeg North. Pardon me.
Thank you, Mr. Speaker. And just to follow up on the previous question, healthcare is a provincial responsibility, but the Canada Health Act ensures and guarantees that the federal government has a role to play, as it should. I would ultimately argue. My question for the member is, does the member believe that the Canada Health Act is something that should be enforced? To what degree? And is there a need for any sort of amendments to the Canada Health Act?
For a very short response.
Well, very quickly, Mr. Speaker, the Canada Health Act is the foundation of our healthcare system, and we need to live up to the spirit and the law of what the Canada Health Act is. And you know, I was asked earlier, is it affordable? Well, if we took even some of the $31 billion in corporate tax cuts that's been taken out of the public purse, we could easily afford what we need to do, whether it's healthcare, housing, childcare, you name it. The pie is there, it's just the way it's divided up.
Resuming debate.